Hello, my name is Tara Griffiths. I'm in the Family Nurse Practitioner program at EKU. The focus of my evidence-based project is smoking cessation. Tobacco abuse places a significant burden on the United States healthcare system. According to the U.S. Department of Health and Human Services, cigarette smoking is the leading cause of preventable death in the United States. Persons that smoke are more likely to develop heart disease, stroke, and lung cancer. When a person smokes, nearly every organ of the body is harmed and the person's overall health is affected. Common strategies to aid in smoking cessation include the use of nicotine replacement therapy, NRT, and cessation counseling. The purpose of this project proposal is to establish a smoking cessation counseling program which is rooted in evidence-based practice and has shown high rates for smoking abstinence. The population of choice for this proposed project includes adult smokers ages 18 to 44 in rural primary care clinics who are willing to commit to a smoking cessation program. Much of Kentucky is classified as rural. Of adults in Kentucky, 29% currently smoke cigarettes. Kentucky has the highest percent of smokers in the U.S. 21.2% of United States citizens currently smoke tobacco. Research conducted by Chan et al. Suggests that NRT alone is not sufficient for long-term smoking cessation. This same study suggested that NRT paired with continued cessation advice yielded the highest quit rates. A study completed by Okuyemi et al. Also concluded that continued counseling sessions yielded the highest rates for smoking abstinence when compared to the standard care, which was a one-time brief cessation counseling session. Burnt et al. Found that the effectiveness of telephone-delivered counseling sessions yielded higher abstinence rates than those receiving face-to-face counseling sessions. The proposed intervention for this program has been developed using up-to-date evidence-based practice research. The proposed intervention will take place in a rural primary care clinic. After a patient has been recruited and informed consent obtained, the next step will be for the APRN to perform an advanced assessment of the participant which will highlight smoking behaviors. The APRN will be given an assessment guide to follow to ensure consistency in each patient assessment. The APRN will also assess for any physical barriers that may be contraindications to the provided NRT. Once a participant is deemed eligible, NRT will be provided. Baseline counseling will be provided, and any barriers to quitting that were identified in the initial assessment will be addressed at this session. Next, the participant will be contacted via telephone at weeks 1, 2, 4, and 8. During these sessions, participants will be asked routine questions regarding their smoking behaviors. Data about abstinence or continuation of smoking will be collected at all interviews. During each session, the same assessment questions will be administered via telephone. Once the sessions have ended, patients will have a follow-up telephone interview where data about smoking behaviors will be collected in the absence of counseling. Once data collection is completed, it will be synthesized and analyzed. The implementation timeline has been provided. The primary outcome measure for this project will be smoking abstinence. Persons who are considered abstinent will endorse not having a cigarette for greater than 30 days. In the earlier counseling sessions, participants will be asked about nicotine replacement therapy adherence and tobacco usage. It is important to note that this project will utilize self-reporting only for data collection. In the study by Chan et al., there was a significant discrepancy between self-reported abstinence and biochemically validated results. Without the use of biochemical validation, there is no way to ensure that participants are being truthful about abstinence. In conclusion, primary care providers are in a great position to provide appropriate tools to aid patients in smoking cessation endeavors. Smoking can have devastating consequences to everyone in which it touches. By providing patients with the smoking cessation program, which has been developed using up-to-date, evidence-based practice, we can help reduce the rate of current smokers and have a positive impact on their future health and the health of those around them. Thanks.